Much for joining our LinkedIn live session on From Commitment to Collective Action, Strengthening India's Safe Abortion Ecosystem, hosted by the Pratigya Campaign for Gender Equality and Safe Abortion. Today's session is not just any awareness session, and today we are not going to repeat what we have heard several times before. The discussions today will be grounded on systems change, advocacy wins, pivots, solidarity, collective movement building, breaking the silos, and moving the needle towards safe abortion access. It's going to be a conversation, and we are going to talk about what it takes to move access to make it safe, dignified, and humane in practice, in policy, and in partnership. I'm Debanjana Chaudhary, and over the next 1 hour, I'll be speaking to experts who have seen the changes happening, who will be speaking about how India's abortion landscape looks much different now and the important legal process that it has gone through. We are going to discuss how access remains uneven. Many of us in this space work very deeply and very intensely, but often separately. And I do emphasize on separately because over the next 60 minutes, we are going to see how we can unify and what a solidarity campaign and movement building looks like. With that as reality, I'm really humbled to introduce our formidable speakers today. We have Dr. Kalpana Apte, Director General of FPA India. Dr. Apte, a very warm welcome. Dr.
Thank you.
Apte is widely respected thought leader in the SRHR and family planning space. She works to translate community needs into policy and scale high-quality SRHR services nationwide. She serves in several national and international advisory committees and brings deep expertise in provider training, quality of care, and reproductive rights advocacy. Thank you so much, Dr. Apte, for joining us. We
Thank
have
you.
Mr. Thank you. We have Mr. Vinod Manning, who does not need any introduction, but I will introduce nonetheless. He is the CEO of IPAS Development Foundation. Vinod leads efforts to improve safe abortion access, comprehensive contraceptive care across 11 states in India, overseeing a staff of over 150. He serves on the federal task forces on abortion and contraception constituted by the Government of India and is a technical expert to WHO Geneva on global health system guidelines. He is also an honorary fellow of the Indian College of Obstetrics and Gynecology and serves as the governing board for Amplify Change. A very warm welcome, Vinod. It's lovely to have you here. And
Thank
then
you.
we have Mr. V.S. Chandrasekhar Chandra. He's currently the country director at AmeriCares India, and he has worked with FRHS India, MSI Reproductive Choices in the past, and have been one of the co-conveners of Pratigya Campaign for Gender Equality and Safe Abortion with all the other two speakers over here. With over 3 decades in reproductive health, Chandra brings extensive experience across family planning, maternal health, safe abortion, and HIV/AIDS. Very warm welcome, Chandra.
Thank you, Debanjana.
Thank you. So, audience, before I move to the conversations, I would request you to kindly put your questions on the chat and also follow, like, and share our social media coordinates, which will be up on the chat very soon. I will quickly share an overview of Pratigya Campaign for Gender Equality and Safe Abortion. This is not just a coalition of 120 organizations and individuals passionately working for improved access to safe abortion in India, but a movement to strive for equity, for gender equality and equity. Simply, our members, campaign advisory group members, partners work to advance women's rights to safe, legal, stigma-free, dignified, and humane abortion care. As a coalition, we have seen the strength in numbers, unified voice, and untiring collective work rather than fragmented efforts improve landscape, policies, and legal framework. With that thought, I move over to you, Vinod. When Pratigya was first coming together as a coalition, what were the biggest challenges in moving forward from parallel efforts to unified efforts to build a coalition? What were some of the trust building efforts that each organization, each participating member organization had to bring in? And what did it mean to have different mandates but unified identity? And of course, if you can shed some light on, skepticism, did you face any when building Pratigya, and what helped move past it? Over to you, Vinod.
Thank you, Devina, and I think it's a good starting point. Uh, you'll all know, or for those who don't know, Pratigya was born in 2013. 2010 had a census where there were the sex ratio was low and it was showing a declining trend. So one of the things that happened is there was a lot of worry and concerns about the declining sex ratio, but also there was a direct linkage between there were many people who felt in the policy and in the programmatic sphere who felt that one way of addressing sex ratios, declining sex ratio, is to clamp down on abortions. Now, all of us know that doesn't work, but that was the tonality of the time when the Pratigya campaign was generated. And given that demand and the fact that you have advocates of safe abortion on one side, advocates on gender equality and gender bias sex selection on the other side, rarely were they two meeting together. We both realized that we are working for women, both realized we were towards sexual and reproductive rights, but at the same time, we didn't have enough common ground to explore and have a common stand. So, Pratigya campaign was actually born from a need to say that probably what we need at the stage is for a diverse group of people to come together and find and explore a common ground. So actually, that's where the name came in. We said we will preserve access to safe abortion while addressing gender bias sex selection, in the sense that both of them are equal, and a very strong belief that both could be addressed. Both the issues of improving access to abortion and preventing gender bias sex selection could be addressed together, and there is a common ground for various people to work together. That was the genesis of Pratigya. And sorry, and what happened? One of our biggest challenges was we were so much in silo, many of us, that we didn't know who were the leading players, leading advocates for gender bias sex selection. So when we reached them, the point that you said about where there's some cynicism, where there's some barriers, yes, because they said you are for abortion and you would say abortion at all contexts. So there were difficult questions. There was a credibility that had to be built, and more than credibility, actually, it was about mutual trust. Trust to be able to sit together and talk about two issues and have difficult conversations. Yeah. Over.
Thank you so much, Vinod, for sharing that. And that is what collective commitment and action looks like. To thank you for sharing why the name Pratigya. You have also answered on why the name Pratigya came up, because that's something that we often come across by Pratigya campaign. And having gender equality and safe abortion in the same breath, it makes so much sense. Coalitions, of course, don't emerge organically. Some coalitions do, but you have to work around it and you have to build around it. They have to be built in a way. And the process is often not very smooth, and it definitely cannot be linear. And let us, make an attempt by going to Dr. Apte to understand how to unpack what work changed on ground. And I want to shift the conversation a little bit from structure to lived experience. Dr. Apte, you have been working in coalitions to change reach, credibility, and of course, sustainability compared to working independently. Do you think working in a coalition can be restrictive? What does it mean from a service provider's perspective? What difference it actually made once you became a coalition member, or led a coalition? How did that coordination contribute to a service delivery? Did it change referrals, messaging, confidence, and advocacy? So over to you, Dr. Apte.
Thank you for that question, Debanjana. It's a layered and nuanced discussion. Coalitions are actually, it's not important to build a coalition. It's important that there is an issue, there is something that multiple people passionately believe in, and they want to work together. So working together is what is important, that multiple organizations, individuals, people who believe in an important issue come together. Now, let's take, for example, where Vinoj left off, and let's talk about Pratigya. That we all have seen the safe abortion landscape in India for last 50 years and more has been providers centric law, which has helped in women accessing to a great extent. I would say that when one looks outside, it's a great law. However, in recent time, with other issues impinging on it, for example, the declining sex ratio being misunderstood to be caused by safe abortion access, the champions who were working towards women's access to safe abortions, we all belong to different organizations. We are different professionals. We all felt the acute need and a sense of crisis that women are not going to be able to access, and the access is being denied, which is a fundamental right of a woman. And not only that, it's a legal right within India. So we all came together. Now, working together as a coalition or a group of people, network or campaign or whatever we may name it, style of working differs. It's an important thing that one must understand that that's the only one point on which we agree. We may have multiple differences of opinion, and one needs to find a common cause. And in instance of Pratigya, the common cause that Vinod spoke about, which became the pivot for a much needed wider consensus, and that's where Pratigya really succeeded spectacularly and created history. In the history of coalition, it's a silent history, one can say, that it was able to bring together people from very diverse and opposing viewpoints on one platform and talking about women's right to SRH. And that is the crux, that you must find the common denominator, the common issue, and you may differ on all other issues, and that's fine. But being organizations, individuals who will come together for that one thing, and then that's where the conversation starts, efforts are pooled, and certainly working alone is not the solution. It can lead to duplication, it can lead to fear of prosecution, it can lead to the position of weakness. And you come as a position of power when you are a collective group of people and organizations. A network with a sound agenda is much more powerful to change the course of history, and that's what Pratigya has been able to do. So I must say that in last decade, Pratigya made spectacular uh, progress in ensuring that PCPNDT and MTP Act are not conflicted, but they are conflated. And that can only come from a committed group of people working together.
Thank you so much, Dr. Apte. It's absolutely inspiring to hear the way you've put about, centered network and networks and the strength of networks absolutely at the heart of coalitions and bringing that common factor, the common denominator of where each passionate individual is working, but to bring all the energies together. Thank you so much for that insight. Chandra, coming to you, from your vantage point, silos, of course, have a very clear, limited impact. What is your opinion about silos? And of course, something that Dr. Apte also mentioned, duplication, mixed messaging, and I want to bring in policy fatigue as well. Because when individuals and individual organizations are advocating, and it's the same stakeholders, they are seeing a lot of different recommendations from different organizations coming in. Where does a coalition step in and break the silos, break duplication, mixed messaging, and also demystifies policies?
Thank you, Debanjana. Let me try to, one is, this is not a silo versus coalition game here we are playing, because every member of any coalition has their own agenda, their own objectives to work on, which is equally important. And then there is something which is common. So I think, I would like to frame this conversation more as not silo versus coalition, but more as how can, there are some things which you can do in a silo mode. As an organization, you have an objective, you have your goals to be achieved. And like, whether it's FPAI, FPA India, or IPAS, IDF, or FRSHI, each one are doing their bit of role in terms of improving access, improving quality, everything. That's very much required, because that's what is beneficial to our clients, because these are organizations who are providing good quality service, access, and care. Now, on the other hand, what happens is a lot of what organizations like service delivery organizations in particular do are also constrained by policies and laws which govern and regulate how they provide services, what they say, whom they say to, etc. So, and that's where I think it's important to bring in a coalition, because when a coalition talks about a particular issue, in this case, in the case of safe abortion, whether it's the conflict between safe abortion and sex selection, gender-biased sex selection, or in terms of how what should be the changes in the legal framework in terms of allowing access to safe abortion. Like Kalpana mentioned that it is still continues to be a provider-centric law. How do we make it more women-centric or person-centric in terms of things? So what a coalition does is it pushes the agenda up and looks at it from a more broader perspective. And what it also helps is that individually, when we work in silos, because we have our own mandate, sometimes we can be seen as having a vested interest in, bringing about that policy change or advocacy, a change in advocacy. For example, if I'm providing abortion services, and if I am advocating for improving access by, reducing some of the barriers, etc., then people can turn around and say, look, you're providing abortion, you want to make your business smoother to run, and therefore you're advocating for it. And that's where the coalition comes in terms of, because fortunately, at least those who are part of Pratigya, or, we are all, while working on our mission, we are also broadly interested and supportive of women's rights, and particularly sexual and reproductive rights. And therefore, and when it comes to advancing sexual and reproductive rights, you need to work on every aspect of it. You need to work on improving access. You need to work on, changing policies, and making conducive environment which will enable women access their right. So I think coalition is important, particularly when you want to make changes at a much macro, bigger level, and where, as individuals, if we are working, we may be, accused of having a vested interest in it. So I think that's a critical thing which we need to be cognizant about. And I think in the case of Pratigya, I think, while initially we started off, as Vinod said, addressing the conflation between gender-biased sex selection and the MTP Act, soon we also realized that it's not just about abortion, but it's more about rights, sexual and reproductive rights. And therefore, I think over the years, initially we were focused on gender-biased sex selection and the conflation between the two. Quickly, we moved into talking about the fact that this is about women's right and women's health, right? And that's where I think we managed to gather more people onto the platform and to be on our side. And when we collectively spoke about it from a women's perspective, from a rights perspective, there were more people willing to join us. And more importantly, there were people willing to listen uh, what we as a group had to say. And I think that's where it's important for coalition that we have something common which binds us all. And as a voice, we are much more neutral when we advocate for what we want, the changes which we want. Thanks.
Thank you so much, Chandra, for bringing in that nuance. And I would request you to stay on a little bit. I do have some follow up questions for you. Uh, to understand, coalition work, of course, everybody is wearing multiple hats because there is an organizational mandate and then there is a coalition collective mandate and a macro level change that it is aimed at. Is there any point, or if you want to share, about risks of a coalition in terms of engagement is harder, engagement is slower, any tips that you would want to share around it, like how to make coalitions work better?
I think whatever you pointed out, whether engagement is harder, decision making can be delayed, etc., all are valid and will continue to face any coalition or alliance which is working. Because, as you know, all of us who are members are one, they join the coalition as voluntary members, whether as individuals or organization. All of us have a day job and we have to, work on our own, organization mandate and mission, etc. So there has always been that clash. But I think what has helped Pratigya is in terms of trying to be very clear in what is the expectation from the coalition members, and also to put in place a very clear plan and assign responsibilities. I think we all learn this as we work in coalition. As initially, we want everyone to be involved in everything, and then we realize that not everyone who is at the table brings the whole breadth of understanding, and each one has a specific strength. Right, somebody is great in communication and advocacy, somebody is great in the technical aspects, somebody is great in terms of bringing in the community and women's voices. So I think trying to look at the strengths with each of the organizations who come in as who join the coalition, and trying to play on that strength and involve them specifically on those aspects is probably one way in which we can help better decision making, as well as harness the strength of the coalition. And I think that's where we in Pratigya, did a good job. I think is by creating these subcommittees which worked on specific issues, and so the secretariat also was able to tap into the membership to get inputs and take actions quickly. The one other thing also is required is to create a secretariat, because in a coalition you can't expect everyone to be voluntarily operating. There need to be certain dedicated people in the secretariat who will move this agenda forward, whose responsibility is to get the whole coalition to start contributing and working towards, and keep us reminding that we are here because there is an unfinished agenda. So I think it's important to have one or two dedicated resources who can actually drive this. And that, I think, again, is something which we learned through Pratigya. Once we had people, one or two members in the team, they quickly took charge of it and helped the coalition move forward, gave it a plan, and monitored that implementation.
Thank you so much, Chandra. I mean, this really, builds into our next conversation, next piece of the conversation that we are going to have, like, the coalitions, how they shape practice, the secretariat that you're talking about, how it brings in the value, brings especially visible during key policy moments in getting all the people together, individuals together, tying up the advocacy, the communications, and the technicalities that are needed. Vinod, looking back, what are some of the lessons from advocacy that still remain relevant today? And if you can share a little bit about how advocacy looked like a decade ago, if we were to make a policy change, and how it has shifted, and again with today's context, with funds shrinking, more excesses from right wing, how has policy advocacy changed, and how coalitions need to adapt better?
Thank you. Maybe let me start with how was it in the initial maybe 8, 9, 7, 8 years? Yeah, probably 8 years. Um, One of the first basics was on the common ground of establishing what our policy guidelines or what's our policy conversation is going to be that's agreeable to all the members. That itself takes time, it needs deliberate intent, and it needs a lot of conversations to finalize that. So, one of the things I think which Pratigya did very well, and I think it's a building block which I think is going to come back, take my word, with the next census, whenever that happens, is the consensus document that was done about safe uh, abortions and gender biased sex selection. Basically, there were about 17, 18 organizations and the government of India which participated in trying to develop a protocol around how should the communication be that without impinging on either of these two issues negatively, and how do we the laws, how are they different, and how do we keep them, as Kalpana said, it is compounding but it is not contradictory to each other. So those kind of that document I think is a powerful document because it was signed by people across. So that was, I think, a cornerstone of the advocacy that the document was then used by various people, and derivatives of the document like policy briefs, etc., were used to spread the message. But again, when you are on a policy advocacy, you're a campaign or a consortium that's on a specific agenda, be careful not to miss opportunities of where you may have to pivot your advocacy for something else. For example, we were at that time very right. We were focused on doing this. How do we find the common grounds and try and make sure that gender biased sex selection does not impinge into abortions, or abortion access does not facilitate gender biased abortion, and how do we get them together. But at that time, I don't know how many of you will remember, CIPLA had launched their advertisement for IPIL. I don't know how many of you would remember, it's been pretty long time back, but the abortion, it was high decibel TV advertisements which went on to stigmatize abortion. So Pratigya took it upon itself, though it was not in its immediate agenda, but it was an issue that impacted one of the streams of our work, that we advocate with CIPLA to highlight the fact that they are how it is stigmatizing and to pull off the advertisement. I don't know whether that worked or what worked, but after some time the advertisement did not happen. So the idea is, the point I'm trying to make is, while you develop certain materials and then keep developing and keep utilizing that in your advocacy, etc., but at the same time be nimble enough as a consortium to be aware of the environment and pick up places where you as a collective voice can address it better. CIPLA, when a 20 organization, at that time we were 20, now I think we are 120 members. But even as the 20 members across, as Chandra was saying, we had research people, we had a range of stakeholders writing to the chairman of CIPLA, had a different impact than Chandra or I writing independently to them. So that's the power that we need to look at leveraging wherever possible for our advocacy gains. Yeah.
Yeah, thank you so much, Vinoj. That's such a brilliant example. And it also brings back some memories of another example from Pratigya about a Sony TV soap opera that was coming out, which was stigmatizing abortion. Then everybody from the Pratigya coalition put their heads together, and there was a sensitization workshop held with the producers of Sony for that program. Absolutely brilliant, fantastic example shared by you about collective action. Thank you so much, Vinod. Coalitions are not just platforms for coming together. It is a shared platform for sharing and exchanging knowledge. Like Chandra, Vinod, and Dr. Apte, they have shared. It's about sharing resources, strengths, and also backing each other up and moving forward together. On that note, we are going to talk a little bit about sustainability and collective infrastructure. And I'll come to you, Dr. Apte. How does a coalition engagement remain sustainable after a long time? What are some of the success indicators for coalition? I'm really apologetic to use the word indicators when we are doing movement work, because movement actually needs continuous, persistent, resilient work. But nonetheless, we are all responding to somebody. Somebody is funding the coalition work, and they would want to know, what does success look like? And how do we make that success sustainable? How do we make it responsive, Dr. Apte? Sorry, Dr. Apte, you're
Yeah,
not
yeah, yeah,
audible.
yeah. Sorry. It's not an easy question because at the root of it, any sustained action, one does require funding resource. And coalitions also, which are funded and funded for a work plan, require some indicators of success, though these will not be hard indicators. But sustainability is another discussion. You may have a funding cycle, and in the funding cycle, you may decide that this is what you would like to do, and this is the issue which needs to be addressed, and this is what you will do. However, the most of us understand that coalitions or networks, they work on a priority basis. They work on a burning issue which emerges, and it does advocacy, and we're using the collective strength and commitment. In that, then the indicators of success would be the resolution or acceptable mitigation or movement forward. That would be a sustainability thing, because you see, by very fact that people come together to address an emergent issue needs to be resolved at some level. There has to be some solution. That it itself is a sustainability and a success indicator, that you have been able to intervene collectively and change somewhat greatly. You change the ecosystem. We are talking about ecosystems today, and the ecosystem of the SRH issue, be it access to safe abortion services, be it an impinging other act of parliament, or practice by the providers or the competent authorities or whatever. One is working towards a certain goal, and that itself finishes that priority of the coalition for the funded cycle or a non-funded cycle. You may also be aware that some of us and a lot of individuals are together working on some other aspects of access to safe abortions, decriminalizing safe abortions in India, and so on, through Arise campaign, Arise coalition. And that coalition is not funded at all, in a sense that there are some small grants here and there, but it's not really funded and work planned and activity led. So under those circumstances, then the sustainability comes from the commitment of the members. Um, in Arise, for example, I can share, and then there are other examples also. Voices for against 365, yeah, you know, that coalitions on HIV related issues and transgenders and so on. And these are the people, when then they commit for resources themselves, they bring their own resources to the table. And in this instance also, I mean, I can say that Vinoj and Common Health and other partners are bringing those resources. They even take up responsibilities. If they don't bring the resources to the table, then they would say, oh, this is what needs to be done. Maybe I have some funds and I have some work plans which aligned with this. So you can work in a multiple ways and see that the coalitions without funding also can be sustainable. They may work slowly because the money is important to see that there is a sustained resource. Just as Chandra has said, he's absolutely right that a dedicated human resource really will make the thing speed up. The other factor is that sustainability is when people are engaged and they continue. While you resolve an issue, you move the agenda a little bit, you move the needle a little bit, and then you take up the next issue. That's another form of sustainability, that from a coalition lens, that people are from very different lens, and those who may be sitting across the table and not together are still willing to come together and get engaged on an issue, is another indicator of success or of sustainability for coalitions. So long term coalitions, I mean, really, they basically are implementing bodies and they find funds and they do things. But short term intense policy advocacy coalitions, networks, or consortium, really speaking, work on very, very focused outcome. So we must understand, when we talk of sustainability, it is the ultimate sustainability is people staying engaged to the core issue of sexual and reproductive health and rights and justice. That is what is sustainability for a coalition or a network, that people trust each other, they may be wherever they are, they stay engaged. And you are a prime example, that you've been part of Pratigya and now you have moved on to do other responsible work, but you stay connected. That is sustainability indicator. And the success indicators, of course, are the work plans and related indicators. So I think I'll stop here.
Thank you so much, Dr. Apte. It is so well put and so well rounded as well, that sustainability cannot be just technical indicators in an MEL format. Sustainability again brings us to passionate individuals working on that common cause. So that passion that drives a coalition remains a structure throughout in order to create sustainability. I have a follow-up question for you, Dr. Apte. Nonetheless, Chandra did mention very clearly about secretariat, and there are no two ways about that. There has to be people responsible who will bring the different actors together in the coalition, because everybody is busy and they are doing their individual work. But there is also a sense of losing clarity in the long term. How do we maintain that strategic clarity, especially when the need of the coalition or the issue for which the coalition was brought in has been met somewhat or partially, or achieved something that it needed to move? And it's not possible to meet entirely everything because issues keep on emerging, we keep on hearing stories, and it's a ground reality that access is not there, stigma, taboo, it's all there. I mean, nothing has moved in a way, though some legal references have improved, but otherwise patriarchy, stigma, taboo, inaccess, all that remains. So how do we tackle burnouts? How do we tackle that strategic clarity and ensure that the strategic clarity remains in long-term coalition work?
I think it's a great question, and I would like to say a few things here. One, I think we don't treat coalitions like institutions or organizations. We treat it like a project. Most of us do, anyways, and therefore we don't build institutional memory of the collective work that we do. That, I think, is the first order of the day, that one must, the coalition secretariat, or whether it is a funded coalition or network or consortium or whatever it is, one must ensure that there is a narrative, there is an institutional memory, and then there are archives for the work that is being done, and it's carefully preserved. Because to follow up on the conversation that you said, that things are not really changed, I would say that not only they have not changed, my worry and the what landscape we see emerging is that maybe things are sliding back to even worse from when we started 50 years ago with the legal access to safe abortions. There are situation is becoming grim. So unless we preserve that history of the coalition work and we preserve that institutional memory, you will not be able to create or find newer people coming in, because you see, human beings need to be, there should be succession planning, and succession planning for the reproductive rights and justice work can only be done through champions who believe in this. It's not a job, it's not a salaried kind of appointment that today you are doing work on, say, safe abortions access and rights, and tomorrow you move on and you do something on skilling. Or, I mean, these are all important fields, but I'm saying that the hardcore commitment to the rights and justice is something that one must ignite, and that can only happen when you are able to get people and ingrain, or not ingrain is in a way very strong word, but kind of ignite their minds, create champions and create commitments. And that is the second aspect of ensuring that you have succession. You have individuals who have been part of the journey. They may have started young, they may have been interns, they may have been younger people who have left and gone away to do other things, but come back, volunteer this work, or do whatever they want to ensure that there is a continuation. So coalitions are institutions, they are organizations, and one must see that the influence and the impact of its work is not only towards changing the policy advocacy, but also changing the landscape of the community, for very community for which it is going to we are working, or it is going to impact or the lives of those people. Unless you ensure that the champions come up from the ground up, the really speaking, the work will not move forward. And burnout is real. We see, what we see is a lot of negativity around. I always say that sexual and reproductive health and rights are, what we see is very negative outcomes we see on the ground. We see sexual assaults, we see unwanted pregnancies, we see STIs, we see so many negative outcomes. So there is a need for ecosystem and the work environment to find positives in that. Celebrate small wins, ensure that even a small success is celebrated and is shared. Appropriate credits are given to the people who are handling and moving forward, because yes, burnout is real, and that burnout will not go away with better salary, better working environment, work from home, or whatever. The burnout is, it leaves an impact on you. When you see a woman going back without being able to access abortion, when you see an adolescent girl not able to access because POXO Act is ensuring that you have to, as a provider, you have to report to the police, and the girl says that I cannot afford to be reported to the police, and she runs away. That heaviness in the heart of the provider is indescribable. So I think it's important that you must celebrate, you must uh, share even small successes across the country, across, even we find joy in that. In some other Latin American country, South American country, if safe abortion agenda moves forward by 2 bits also, it's a great inspiring and uplifting kind of a movement. So I think we must find those occasions, we must have those kind of pathways to see that successes are celebrated, credited, and we continue to work together, lift each other up, laugh often, and have very good working environment, be friends actually. So that's what I have to say.
Thank you so much, Dr. Apte. And I've been particularly lucky to have mentors like all of you leading the work for Pratigya when I was in the secretariat. So it has made work enjoyable, and it really kind of stems from the passion of trying to help an individual. And like you said, this work is really heavy. It comes back home. This is not a work that you leave the moment you switch off your laptop, your gadgets, or you get out of your office. It stays with you, and that's why it is important to have that that ecosystem within us, that ecosystem within the community of activists and advocates to support and back each other up. Thank you so much for that amazing and splendid share, Dr. Apte. Vinod, we are talking about ecosystem perspective and what makes coalitions worth sustained investment. And this is my question to both you and Chandra. So maybe Vinod, you can respond first. That we do talk about ROI and sustained investment, right, in some parlance. So how do we, I mean, look beyond that when we are talking about coalition work? How do we look at coalition success beyond just an ROI and an investment? And how do we really move funders at a time when the funding landscape is extremely skewed? What do we do? And this question is for both of you.
Thank you. You reserve the tough ones for the latter part of the conversation, right? Actually, I think let me try and attempt an answer using a very real on the ground example. As Kalpana's organization, FPI, is a secretariat for an alliance on the particular right, on safe abortion, like say abortion. It has not been really funded, as you mentioned. It's been going on now for 3+ years, I think, and it's not been. Unlike many consortiums, there's no dedicated money available. People bring in money where possible, etc. And there's a lot of voluntary contribution. So I remember a conversation where the core group was talking to a donor, and something similar to your question came up. What's your measure? So I remember talking about it and saying the measure is that if you really look at this group and the larger group of about 30, 40 people who have been engaged with this consortium for so long, if you put in our time cost alone and give us a matching contribution, that would be enough to take us through. So how do you really put an ROI to time costs? But more than time costs, with the burnouts and all that, despite that, people coming in and sustaining together as friends, as colleagues for a period of 3 years where there is no financial incentivization. So I have a feeling, okay, we can call in an econometrist and have a very fancy modeling for calculating a return on investment on this parameter, but why bother? So, but for sustainability, there could, as you say, no work. I have a colleague who keeps saying, if you don't measure it, it's not worth doing it. Right? And I also believe in that. So we may have to look at what should be the real measures of looking at a consortium or campaign's work in terms of outputs and, if possible, outcomes. Because the kind of work that we do, the policy and advocacy work, is long-term outcomes. But outputs are definitely measurable. We measure them. So I do think we may have to look at ROIs from a different lens to measure campaigns, because otherwise none of them are going to take root and take on. Over.
Chandra?
Yeah, it's an interesting question, and I think all of us grapple with this every time, this return on investment and sustainability, etc. And I think my co-panelists will agree that probably this is something which is, these terms are often thrown around more, and we all know that if whatever we have been doing and we have been involved in was sustainable, in terms of the fact that the market existed for it and the clients were willing to pay, I think somebody in the business community would have already done it, right? If and But the fact is that we are all dealing with issues which actually impact the most vulnerable sections of our population, and it's difficult for us to measure what is the return, as well as ensure that, oh, by 3 years or 5 years it will become sustainable. So I think this whole, while as not for profits, we need to hold ourselves accountable to the mission and to our clients, and therefore we need to measure what we do and see that we utilize our resources effectively. I think this whole emphasis on sustainability, emphasis on return on investment and all, I would say is unfortunately a intervention from what I'll call the corporatization of not-for-profit. So everyone is now talking about sustainability, talking about innovation, starting about return on investment, measurement, etc. As if we are that really makes we need to bring in certain good elements of corporate and business practices into how not for profits operate, but then we cannot again take the same measurement to measure the work which we are doing. So to me, uh, you know, all of us, because we are forced to do it, we will in every project proposal we'll put in sustainability, etc. Though we know that look, if we are the only time we'll become sustainable is when we are no longer required, and particularly when it comes to sexual and reproductive health and rights and justice, I don't see that happening in the very distant future also, because there will always be a need for somebody to work there and to be present there. So I think rather than saying looking at sustainability or return on investment, I would really like to add on to what Kalpana mentioned. I think we need to see what differences we are making to the lives of people whom we are working for, or on the issues which we are working for, you know. And often this cannot be, say that this is X percentage increase or no. The fact that if we can, we moved some of our asks in terms in the MTP Act, though we didn't, we were not successful in actually getting our entire wish list incorporated. But that itself has make a tremendous impact for a lot of people. The fact that we Pratigya talked about the absence of medical abortion drugs at the retail outlets, or the impact of judicial legal analysis, which brought out how difficult it is for women to access some of these. So these result in sort of sustainable change, and how do we measure that? When just moving from 20 weeks to 24 weeks is a huge return on investment, and I think it's difficult for us to measure it in terms of was it 25% return or 50% return. Similarly, for removing the 20 need for two providers for the 12 to 20 weeks, again is a remarkable return on an investment. Similarly, moving treating medical abortion as a separate category, and getting a provision in the law which says that you can be only a medical abortion provider is a huge victory in terms of huge return on investment that was possible. But again, we can't measure it in the same terms as we measure corporate profits or the balance sheet. And I think that's important to look at as to how is this going to make a big difference in the longer term, and it cannot be reduced to numbers, which is what corporates. And when I say sustainable, as oh, will Pratigya function if there's no funding? But what Pratigya has done, or many other coalitions in this country have done, is they moved the needle, which is sustainable, which is, we have moved the needle in terms of improving access. We have moved the needle in terms of improving the policy environment, which is a huge sustainable, a victory for us, because uh, that's something which we need to see how we can present those as, sustainable impact of our work, as well as return on our investment. So it's, I find this fascinating, the conversation, because many a times we keep talking about these terms, but there are nuances to it, and we cannot think of it in terms of just numbers, but think in terms of the impact it has on the lives of people.
That's
So,
right. Thanks so much, Chandra, for that extremely detailed, you know, um, detailed perspective on ROI, which we strongly feel as individuals working for Pratigya campaign or any other coalition. And now with AI coming in, there is so much misinformation that is there in reproductive health or in general healthcare. How to reduce harm is going to be an essential part of all the conversations. And I would request our hosts to get all our speakers on the camera so that I can ask one last question. We got some 4 or 5 questions from our audience, so thank you so much, audience, for your questions. Due to lack of time, we are going to respond to your questions via email. Pratigya Campaigns Secretariat will take your questions to our experts here, to our speakers here, and they are going to respond to it. But one very important question that has come up, which we don't ever think about, because we all engage in different capacities as organizations and individuals. But one recurring question that came in was that, can an individual be part of a coalition, or does it have to be an organization? And what does it mean to be a part of a coalition? So, as Pratigya, Chandra, Vinod, Kalpana, if you can share, if there's any criteria to join Pratigya or to join Arise, what is that common thing that the person needs to, that individual needs to bring in order to join this burning fire for, activism? I maybe Dr. Apte can start, then Vinod, and then Chandra.
Thank you, Devanjana. Of course, it depends on the coalition or the network, their decisions. You see, they decide whether it's an organization-led or organization members only or individuals members only. So I can speak for Arise campaign that yes, it is possible to join as members, but what it requires is that you need to be recommended by someone, like a reference, and then you can become a member. And so you need to know someone who's a part of the coalition, because you see the work that we do, and that the representation that a member has comes with a lot of responsibility, and comes with a lot of commitment, and that can only be done through this kind of filter or a layer that one has to do. But at the same time, you don't have to be a member to do work for women's healthcare, or not only women healthcare and reproductive and justice related intervention. You can always become a member of not necessarily a coalition, but you can volunteer with various different organizations. FPA India works with volunteers, youth, or otherwise. You can become a FPA India volunteer, or you can do a lot of work without even being a member of a coalition. And then becoming a member of the coalition may be coming second. If you already have a connector, if you know someone, you have done internship work, you've done some work, you're already connected, then it's even easier for you to do. So I would say that if you have done no work almost at all, you haven't gotten into this, and then to become a member of coalition, maybe 2 steps forward thinking. One must start and understand the ecosystem, would have contributed, would have understood, be willing to learn and do work. Then you could move on. So that would be my take on becoming an individual member. There are multiple coalition in India who also welcome individual members. So, but you must also bring something to the table. It's a two-way relationship.
Vinod.
Thanks, Kalpana, for clarifying that individual members can become parts of the coalition consortium, because I would hate to be kicked out of Arise the day I leave IPAS Development Foundation. So there is hope. There is hope. Having said that, I would like to just really substantiate what Kalpana said about an expectation that, you see, any such association is working on a basis of a primary common cause, which we all are working towards. So, for arriving at a common cause, believing in that common cause, and feeling it would require some exposure, some lived in experience or lived in experience, which is where I think the point that Kalpana made about having some kind of engagement with the cause, with the realities, and having lived through it in any which form, would be helpful for the member to be a contributing member to a coalition. Yeah.
Thank you so much. Chandra, your
No,
take.
I think it's finally it boils one of both, as Vinod and Kalpana mentioned. For individuals to become part of the coalition, one, they need to be invested in that issue and be passionate about it. More importantly, I think it is the way the coalition is set up and what are they trying to achieve will also decide in terms of whether you will have institutional membership or individual membership. Because again, as we talked about, is Katna mentioned about engagement. If you have larger number of individuals as part of the coalition, then your engagement with each of the individuals also becomes quite onerous task. So it's not that. I think in Pratigya also we do have individual membership possibilities. But I think from a point, what are the issue you're trying to address and what are the solutions you're looking for? If that demands a huge individual membership, then the coalition should go out for it and get more individual. But if there are specific issues which need to be addressed and which needs larger organizational support and input into that, you need to focus on building coalitions with organizational membership. So I think there's no one answer to it, but I think as far as safe abortion or sexual and reproductive health and rights, compared to sexual and reproductive health and rights, safe abortion is much niche part of it. So in these cases, I think it's important to bring, and also given the sensitive nature of the issue we are addressing, opening it up to everyone is not a good idea. And therefore, bringing in selective individuals, like for example, as we know it says, if he leaves IDF, but given his background and everything, bringing him as an individual expert to any coalition on sexual and reproductive health will add value to it. So I think coalition should be open to the fact that yes, organizations are important, but at the same time, there are specific individuals and champions whom we should make an effort to bring in, and also to bring in leading opinion leaders who have the visibility in the media and policy corridors would be helpful for alliances to move their agenda.
Absolutely. Thanks so much. I mean, I couldn't agree more to all three, what all three of you have mentioned. Thank you so much, Dr. Apte, Vinod, Chandra, for these excellent shares, for bringing in your lived experience, telling us what it means to be in a coalition, what does sustainability look like, what does moving from parallel action to purposeful collaboration look like, and the pain it takes as well. Collaboration needs the work to be put in, and what it needs to be done is absolutely clear for all of us. I would also like to thank all our audience who've joined in, and the Pratigya Campaign Secretariat, CEO of FRHSI India, Ashutosh Kaushik, Neha Srivastava, the Secretariat for Pratigya Campaign, Gaurav, Pratigya Campaign Secretariat member, and all those who are helping at the back end with the tech and the fantastic audio uninterrupted. I think we have mastered webinars and mastered live sessions after the pandemic. So thank you again so much. It's such a pleasure to always meet you. I always go back learning something from each one of you. Thank you so much. Have a lovely evening.
Thanks, Debanjana.
Thank you, Debanjana. You pulled it out of us, actually. It was fantastic being with friends. Bye-bye.
Thank you.
Bye bye.
Bye. Bye.
Bye.